Okay. Good afternoon, everyone. My name is Nancy Mears. I am a health and well-being extension agent with the University of Delaware, and we are so happy to partner with the Arthritis Foundation for today's Lunch and Learn event. As most of you know, we partner with the Arthritis Foundation on an educational program that we offer, Walk with Ease. And we are happy to be able to partner with them today on this Lunch and Learn event. So just a couple reminders for today's event before we get started. If you have any questions at any time, please feel free to type them in the chat, but feel free to network and discuss with each other as we go through today's event. If you are someone who suffers from osteoarthritis, today you're going to learn lots of different information to help you manage your condition. The most important step of tackling any chronic illness is to first understand the illness. So today we're going to discuss symptoms, causes, and risk factors of having osteoarthritis and how it differs from other forms of arthritis. Then we're going to move on and talk about how you can manage your arthritis and its symptoms. This will include a variety of self-management measures, medications, and alternative and complementary treatments. Lastly, we're going to cap off our discussion by sharing some various resources that will help you manage your condition and how we can help you live fully. So today, we are very excited to have with us our speaker, Dr. Udi Kerbel. He is an orthopedic surgeon with First State Orthopedics. He is fellowship trained in minimally invasive hip and knee replacement and complex revision joint reconstruction. So welcome, Dr. Kerbel.
Thank you so much. Thank you for having me today. Pleasure to be here joining you with the Arthritis Foundation and the University of Delaware. And I'm excited to be here because this is my passion. This is what I've dedicated my career to. You know, there's a lot of different things in medicine and especially in orthopedics that we can do to help people. And arthritis is really one area where we've had a huge breakthrough in the options that we can give people to get them feeling better. And that's why I chose to dedicate myself to it. There have been some articles published over the last few decades, including one in the Lancet in Great Britain where it's called Total Hip Replacement, the Operation of the Century. And it's pretty amazing when you look back over the last, even just 50 years of medical treatment and see what patients with arthritis had to endure back then and what options we can offer them now. Absolutely incredible. We've been able to change people's lives. And so I'm privileged to spend my career doing that and helping people change their lives. And this is what I see all day, in and out on a daily basis, osteoarthritis. So we're going to talk a little bit about that today and hopefully give you some options for getting you through your symptoms and getting you feeling better. So first of all, let's talk about what is osteoarthritis, because there are lots of other different types of arthritis, and osteoarthritis is one of them. So you have rheumatoid arthritis, you have immune diseases, you have post-traumatic arthritis, which can be a variant of osteoarthritis. You have avascular necrosis. There are all these different kind of things. Today, we're going to focus more on osteoarthritis, which is essentially where the cartilage lining of the joint breaks down. And as we're going to see over here, it's not just the cartilage, but that's sort of where it all begins. So it's not just wear and tear, which we all get on our joints to some degree. I tell patients, you know, it's a mechanical device. You drive a car for 100,000 miles, it's going to get some wear and tear on it. But I see plenty of patients in my office who are 80, 90 years old who have great joints. So there's various reasons behind it, and we're going to go into that a little bit too. But basically, this arthritis can include all the elements of the joint. So it can affect the bone, the cartilage, the ligaments, the tissue surrounding it, and it can affect it to various degrees. Some people get the whole of their joint affected. Other people have, you know, just part of it. I do some complete replacements, some partial replacements. But this diagram on the right kind of gives you an idea. If you look on the left, you see where it says healthy joint, and it's got a nice white, shiny lining around the bone. And that is more slippery than ice on ice, that surface there. So the bone glides nicely and you have good range of motion of the joint. On the right side, you can see what happens when it starts breaking down. And now instead of a nice icy road, there's potholes, there's cracks, and it starts basically having roughness and grinding. And that's kind of what arthritis is when you have that degeneration of that smooth surface within the joint. when we're talking about osteoarthritis, it's really a clinical diagnosis. There's no single test for osteoarthritis. So whereas some of the other forms of arthritis, such as rheumatoid arthritis or things like that, there are certain lab tests that we look at. In osteoarthritis, there's really no one test, and it's more about listening to the patient and seeing what brings them in. So when I see a patient for osteoarthritis, I get their full medical history. I examine the joint that's affected. We also can do some lab tests, and of course I look at imaging, although I always tell patients, I treat you, not your x-rays. It is possible that you have really bad x-rays and you feel fine. It's also possible that, you have not so bad x-rays and you're in a lot of pain. All of it has to come together as a big picture for me. And as it says over here, sometimes symptoms can appear before showing up on imaging tests. There's some patients that I see and you get their x-rays and they're really not that bad. And we try different things and we see what's going on. Eventually, sometimes we might order more advanced imaging. And it turns out they had arthritis that just didn't show up as much on their x-ray. So it's really a holistic picture of you as a patient. And it can overlap with other chronic pain conditions as well. So, you have things like pseudo-gout or gout. You can have carpal tunnel. You can have neuropathy, tendonitis, sciatica, plantar fasciitis. All of these things often are sequelae or sort of knock-on effects of arthritis, because when you get the arthritis, it often affects the way that you walk, the way that you move. And if you're not doing that right, other knock-on effects downstream happen as well. So let's talk a little bit about some of the symptoms that you might have. Joint pain and stiffness is obviously the big one that most people know. But sometimes people come in and it's not even pain necessarily that is their main thing. They may have limited range of motion or mobility. Some people come into me and it's not so much pain, but they're like, I just can't walk around. I can't get around like I used to. I'm having difficulty mobilizing. It's hard for me to get out of bed in the morning. Some people complain of clicking or popping sound when a joint bends, although I will say that that is not always such a bad thing. Plenty of people have asymptomatic clicking or popping, and if it doesn't bother you and it's not really a big deal, then I wouldn't worry about that. Some people come to me because they're worried about the clicking. As long as it just happens occasionally and there's no pain associated with it, it's usually okay. You can often have swelling or muscle weakness around a joint as well, and that's a common presentation that I see, and that gives us a little clue that something is going on in the joint that's making it a little bit angry. And of course, one thing that becomes very worrisome to me is when you start having joint instability or buckling. And that's when I start having a talk with patients about maybe it's time to really start thinking about how we treat this, because a joint pain from arthritis may not necessarily be so debilitating yet, but if you aren't taking care of it and that joint gives out and you fall and now we have something like a hip fracture or something like that, that can be a really big deal. So a lot of times it's important to connect with your doctor and come in and get the care that you need to make sure that we're keeping you safe and that we're not putting you at risk for other events that could happen because of your arthritis. Another thing to keep in mind with arthritis is it can affect lots of different places in your body. It can affect your hips, your knees, your fingers, your feet. I see patients with arthritis all over their body. The main areas that I treat surgically are the hips, the knees, and the shoulders. But plenty of times we see patients coming in with their fingers and their feet as well. And oftentimes it's something that affects your entire body. Not always, but sometimes. So that's just to keep in mind. It's all part of this global picture that we look at in you as a patient. So let's bust some myths about osteoarthritis now as well. Let's talk about true and false. So true, it is degenerative joint disease. I would take, I wouldn't agree necessarily with the entire joint. Yes, when we say the entire joint here, it means, like I said earlier, all the elements of the joint. But sometimes people don't have the entire joint infected. In fact, that's kind of one of my passions is sometimes patients come in and they only have the disease isolated to a particular part of their joint. And I think sometimes people are too quick when they have isolated disease to just one part of their joint, especially in the knee, that if they do decide to go into surgery, they replace the whole knee. And sometimes there's options where we don't need to do that. We can just focus on the little areas that are affected. So that's something that I think is important to keep in mind. Another thing that's important to know is that there are many contributing factors to development of osteoarthritis. A lot of times patients come into me and they kind of want to Monday morning quarterback and look back and be like, was it that injury I had when I was 4 years old? Maybe, maybe not. There's lots of things that usually go into developing this. Some of it is age, for sure. But like I said before, some people age and don't get arthritis. Some people get a previous joint injury. You might have had one when you were younger that you thought nothing about and did lead to post-traumatic arthritis. More often than not, those old injuries weren't necessarily the cause. Obesity can impact, when you have a high BMI and you've got a lot of weight on you, all that weight gets translated onto your joints, and that can lead to a lot of pain and dysfunction. And that's why I always encourage my patients, as one of the things that they can do to change their life around, is trying to lose some of that weight which can only help with managing your symptoms. And then there's another thing that's a big component of genetics and gender as well. You know, a lot of people that come in and I ask them, did your parents have arthritis? And they say, yeah, my mom had it, my dad had it. And unfortunately, some of that is just the luck of the draw. You know, you can't pick your parents, but if they had it, you might be getting it too, but not necessarily. But this is something that often is a multifactorial thing. The symptoms usually build over time. And the key thing is to just understand what's going on and to learn how to manage these symptoms. And that's really what the goal of this presentation is today, is to give you these tools so that you don't feel like you're alone or you don't know what to do. But this is something that we as a group with the Arthritis Foundation and, you know, my practice, we're looking to help patients to get over these symptoms. And I will say, I saw a question popping up in the chat there. We are going to have some self-reflection slides coming up in a second. And during those, I'll take time to pause and just address some of those questions that are coming in. So keep the questions coming in the chat and we'll take a moment to address them very shortly. Another thing, other things that are false product of aging, like I said before, just because you're getting old doesn't mean you're going to get arthritis. And, you know, another thing is the more you use your joints, the more pain experience. Not necessarily true. And a lot of times patients come in and they ask me, they might come in with really bad arthritis. And they ask me, well, should I stop doing the things that I love? Should I stop being active? And I always tell them, no. You know, at this point in time, the damage is already done. You already have arthritis in that joint. But the goal with managing it is to try and keep your quality of life as good as possible. And being active is important. That keeps you healthy. It keeps you vital. It keeps your energy levels and your love of life around. And that's what we're trying to do. That's my goal as an arthritis doctor, is to still help people have a good quality of life and enjoy what they like doing. And so that follows on with this next point. After the diagnosis, there's nothing you can do except surgery. I would say the vast majority of arthritis patients I see, we don't jump to surgery. You know, we might down the line. Some patients are so far down the line that we get surgery right away, but a lot of them, we brainstorm together and there's other plans that we can come up with. And that's, again, what we're focusing on today, is giving you some of these other plans you can use to kind of help manage your symptoms. So let's talk about how you can live well with OA, right? We have the medical management piece. The surgical is one part. We're going to talk about other medical options you have, how you can manage yourself, and what other things you can do to really help alleviate these symptoms. So first, let's talk about healthy eating and weight control. And one thing that I like to reinforce with my patients, especially when they're undergoing surgery, but even before then, I tell them, the silver lining of this is this: you have been presented now with an opportunity to really think about turning your whole life around, right? We all want to eat more healthily. We all want to exercise more. We all want to be better control of our mental status and how we're feeling. And I think sometimes a diagnosis like this can be the straw that, you know, breaks the camel's back. It can be the final thing where you tell yourself, you know what, I've had enough. I'm finally going to make that difference and turn my life around. And that's part of what I see as my job as a doctor, is to kind of be your partner along that journey and inspire you to believe in yourself and really make these changes. And one of them, which you may not think about right away, about is healthy eating and weight control, but it's a huge aspect of managing your symptoms. If you think about it, as you can see at the bottom of the slide, right? Losing 10 pounds takes 40 pounds of pressure off of your knees. So if you think about it, a small lifestyle change, if you can take 40 pounds of pressure off of those knees, imagine how much better they would feel when you're walking. And if you want to kind of get a tangible sense of this, try going outside and walking while holding your dog or your kid, or if you have a weighted vest or something that weighs 40 pounds, put that on. Try walk up and down a little bit and see how much more pounding on your joints you feel. Imagine now if you could just take that vest off or put that child down. If you lose that weight, you could do that permanently. So there's no special arthritis diet, but we do encourage patients to avoid foods that worsen inflammation, right? So processed foods, sugar, red meat, fried foods, things that we all know we shouldn't be eating as much of. It's a good idea to try and moderate those. It doesn't mean you could never have them. Absolutely, you should always have some elements. We have Thanksgiving coming up. I tell patients, ask me, do I have to be eating perfectly the whole time? No. On big events like that, you have birthdays, you have Thanksgiving, you have, things like that. It's okay sometimes to have them, but just don't let every day be one of those days. Limit those, and it makes those moments more special as well. So the goal is to try and avoid those foods and to also take in these foods that can help reduce inflammation, right? So fatty fish, olive oil, dark leafy greens, nuts, beans, things like that. All of these things can play a big part in reducing that inflammation level in your body and helping you, lose that excess weight and alleviate the pressure on your joints. Now, another one that's very important is exercise, right? So, and I see a question just popped up about that, and hopefully some of it will be answered in the slide. And again, we're going to have a pause for reflection slide in just a couple moments, and we're going to talk about some of these things then. But exercise is really important. People ask me, should I stop exercising if I have arthritis? And I always tell them no. I'm like, you can basically, one way or another, there's going to be, you sort of have to pick your poison, right? So either you can be very active and maybe have a little more joint issues because of it, but be healthy overall, or you can say, well, I'm not going to do anything. I'm basically going to sit on my couch and take it easy. And sure, your joints might feel a little bit better, but then you're going to have heart disease and all these other things. So one way or the other, I think being active and being healthy overall is the much better choice. And, you know, part of it is we can manage some of these other issues you have with your joints. And that's, again, what we're trying to do here today. So movement is medicine. I 100% believe that. I encourage all my patients to keep active, keep healthy. You want to keep those joints moving. If you don't move them and you let them get stiff, it only makes things worse. So being active is important, but you have to do it in a way that doesn't cause you pain, right? So low impact exercises are really the way to go. You want to do things that are a little bit less strain on your joints. So elliptical is great over here. We have a picture of someone here with, you know, aquatic exercises, which is obviously excellent. I'm a big fan of biking. Everyone loves their Peloton now. I think that's excellent. And for a lot of my patients who, you know, can't tolerate the high impact activities, that's excellent too. Even if it's just walking outdoors, anything like that, it's great to get some activity. So aim for 30 minutes a day. Start slow and work your way up. For some people, that's not much. For some people, that's a lot. You have to do what's right on your level and slowly work up. So we recommend a well-rounded routine. We encourage strengthening exercises, and whether that's something like weightlifting or Pilates, but something that actually involves using your muscles for some kind of strengthening type activity. Range of motion and stretching is very important. If you want to go to a formal yoga type program, that's great. Nowadays, we have on YouTube plenty of videos and guided tutorials you can find, but something that keeps the joints moving. And then something aerobic or cardio, which is good for your heart and your general health. So whether that's swimming, cycling, elliptical, all of these things coming together are going to be a great exercise plan. Now we talk about medication, right? So everyone, there's been a lot of focus on some of the medicines that unfortunately have an adverse effect on patients. And I'm very cognizant about when I start patients on medication, making sure it's the right one for them and making sure that if we do it, it's carefully chosen and it's for the appropriate length of time, right? So when I give patients medication for arthritis, I tell them none of this is going to solve the problem, right? We can't, unfortunately, put the cartilage back, at least not yet. There's plenty of research going on in that. But our goal is to try and minimize the symptoms of the disease and then hopefully get you on an exercise plan and get you doing these other things like losing weight and exercising and reducing inflammation. And that is what can actually help the real symptoms alleviate in the long time. But sometimes people need a little help to kind of get over the hump. There's different things that I give patients. A lot of things are over the counter that people are already taking, things like Tylenol, which is, just a pain reliever. There's anti-inflammatories such as Aleve or Motrin, ibuprofen, aspirin, or, Advil, things like that. And a lot of people are already taking these. You just have to be a little bit careful with these if you have liver disease or kidney disease. But for most people, a short course of this to help alleviate your symptoms or a little bit occasionally as needed is just fine. I prescribe a medicine a lot that I like called meloxicam, which is another type of anti-inflammatory. And I like it because it's only 1 pill a day. But some of these anti-inflammatories are a little bit tough because you have to take 3 pills every 8 hours. I'm like, do I need to set an alarm on my phone to remind me? It just gets a little bit tough. So often I will encourage patients, I'll get patients started on a very short course of meloxicam, which is the one I like, just to get the symptoms down. But often that's in adjunct to them starting an exercise program or something like that to kind of get them really helping hopefully alleviate the pain in the long run. There's also cortisone shots, which I do a lot in my office. And we have some regular cortisone. We have some fancier ones now that have just come out on the market that are supposedly longer acting. And I offer all of these to my patients. This can be very helpful. Again, doesn't solve the problem, doesn't put the cartilage back, but can really just calm that inflammation down so that you can get back to that exercise, back to the other lifestyle changes that are what's going to make the change in the long run. And now we have some really great topical creams. There's one called Voltaren, which is diclofenac is the generic name. Very helpful. A lot of patients really benefit from it. And these are particularly great for patients who can't tolerate the oral anti-inflammatories because of other medical issues or if they're on blood thinners. And this can be really helpful adjunct for those patients. So these are all things that I prescribe a lot. I really do not like opioids. I strongly encourage patients, if they've been prescribed them by other physicians, to really try and limit them. These medications have a lot of side effects. They can become quite addictive, and a lot of people have really big problems from taking them. So our goal is to try everything else aside from that and really discourage that. And I really don't prescribe those except for a short period of time right after surgery. Fine. And then, of course, working with your doctor to do all of this, right? So this is where I come in. This is my passion. And it's really important with arthritis. Arthritis, one of the reasons why I became an arthritis doctor is I like long-term connections with patients. And some of these other things we treat, patient comes in, we give them a little thing, change their medicine, give them, a brace or whatever, and they're out the door. And that's great. I love solving problems that easily. But I also really enjoy developing these long relationships with patients, because some of my patients, I treat them, and then I treat their family members, and it's kind of a family affair when they come and see me, and I'm like, hey, I saw you last week. What are you doing back? And they're like, oh, well, I'm here today with my, my husband or my, significant other, and I love that. I love developing those relationships, and I think especially with a chronic disease like arthritis, working with your doctor is really important. So you want to find someone that you feel comfortable with, and you want someone who's going to understand you as a person and everything that you're dealing with, right? All of these challenges that you may be having with changing the medication, changing the lifestyle. Part of my job as your doctor is to do that with you and help guide you along the process. And if I'm not the right guy to do it, then push you in the direction of someone I know who can. I've been fortunate to develop now a network of people who sometimes they're better than me. I have doctors who, if patients really need to lose some weight and they're having a tough time, I can say, listen, I know Dr. So-and-so is the person you need to go see, and I'll refer them to that person, and then I'll work together with that doctor to help them. So you need to let your doctor know how much this is really impacting your life so that we can help understand. I have some patients who come in and tell me, yeah, it kind of hurts. And then, their spouse is in the room with them, and I'm like, what are they not telling me here? And they'll be like, no, they can't walk properly. Every morning when they get out of bed, it's bothering them. They can't do the things they used to like to do. We can't walk as far as we used to. So it's important to pay attention to how it's impacting your daily life, how it's affecting your relationships. The other medicines that you're taking, are they working for you? Are they not? And what goals are you trying to get back to? And how are these obstacles from your disease preventing you from getting there? Next slide. So when you come to me, like just echoing from the previous slide, tell me really, I want to know how it's affecting your life, and really tell me what are the things that you can't do that you want to do. So when you come and see me, that's what I want to hear from you. Next slide. All right, so this is one of our reflection slides, and we can take a moment here to think about these, and I'll answer some questions while you're thinking. But I want to think about, if you were to come and see your doctor about arthritis, really think about how you would explain that. I want you to take a moment. If you were talking to your partner and you would say, when you were talking about how it affected your life, is there something you would tell them? What would you tell them? What would you tell your family? What would you tell your kids, your coworkers? All of these things, if you think about them, you might describe things differently with what you're going through. And I just wanted to take a moment. I'll leave the slide up for you to think about it. And while you're doing that, we'll take a couple seconds just to answer some of the questions in the chat over here. So the first question that came in earlier, so if your parents have it, will you likely have it? It's difficult to say. It's a very multifactorial inheritance thing. So certain genetic conditions kind of go like that. If your parents have it, you have it. Some conditions are, if your parents have it, you might have it if they were carriers. Arthritis is really a very multifactorial thing. I see some patients where their parents have it really bad and they have none. Other patients where it doesn't run in their family at all and they have it. So it's not a very simple genetic inheritance. It can go either way. The next question we have here is, what are the most recommended forms of exercises? Hopefully we answered that before. And that is, things that are lower impact on the joints, such as swimming, elliptical, bike. And recommending physical therapy prior to surgery, that's a great question. And I think that is something that I decide together with a patient. It can go either way. I think there is no harm in doing physical therapy prior to surgery. Some patients really like that idea of doing a little bit of prehab. And I think that's particularly useful for patients who may have range of motion limitations or things like that. If we can get that range of motion a little bit better before surgery, then it can help with the recovery afterwards. Another nice thing about doing that is you have this continuity of care. So I think it's nice for patients to go see that therapist, do a few sessions before the surgery. They have an idea of you and who you are. And then after the surgery, they kind of already know you. They already know your baseline, and that helps them really tailor it and get you feeling better after surgery and kind of get you back to where you should be. So physical therapy prior to surgery, if my patients want it, I encourage it, but I don't think it's by necessarily you have to do it. And then we have another question over here. I have arthritis in pretty much every joint plus gout. I'm so sorry to hear that. Sometimes it seems like I have a doctor for every body part. Would I benefit working with a rheumatologist? Excellent question. And I think absolutely yes. Rheumatologists are very smart doctors, and they are very good at kind of tying everything together. Sometimes that involves making a diagnosis that you didn't even have. Sometimes they're the ones who, if you are not getting surgery and it's more of a medication and injection management, sometimes rheumatologists are the best ones to do it. Because, for example, when I see patients, so I'm happy to inject people in their hip or their knee or their shoulder, but if someone has, wrist pain or ankle pain and they want injections there, a lot of times with that, I would send it out to one of my partners who could do it under ultrasound guidance or something like that. And it can, I'm okay doing that, but sometimes it's annoying for the patient to kind of have to schlep back and forth between different doctors. Sometimes rheumatologists are really good for being able to kind of treat all the joints at once and bring them together. And often they work in partnership with me, where the rheumatologist is kind of managing it chronically. And if you have a flare-up or an exacerbation or gets time for surgery, then the patient comes to me and we can take over from there. But that's a really excellent question. All right, so let's get back. Hopefully you've had time to think about this. Let's get back to the slide and let's keep moving forward. The tracking is a good thing, especially if right now, if I ask you, how is it affecting you? And you tell me, it just hurts. Tracking might be something good to keep an eye on, because I always ask patients things like this, when does it hurt? What makes it better? What makes it worse? And sometimes patients have a tough time telling me, and this kind of information can give your doctor an idea of different ways to track it. So one thing that I would recommend doing is just kind of take a moment to reflect on it for yourself and track your symptoms and your flares so that you get an idea of patterns that are emerging. Next slide. So tracking doesn't just mean your pain. It's a lot of things that can all play into giving your doctor an idea about how it's affecting you as a person. So I ask patients about all of these things. Your pain level. Is it affecting your sleep? Is it affecting your mood? Are you, it says water intake, but sometimes people with water intake and food choices, people aren't eating well because they're so depressed, basically, about their symptoms. And, that's not even mentioned on the slide. It's, mood, but sometimes arthritis can really get you down, and it can affect other things. And you get so miserable because you can't move and you can't take care of yourself. And that can affect also make the food choices and things like that harder. So all of these things are things you want to pay attention to. And you want to see not just the pain, but other symptoms too. Stiffness, mobility. Are you finding that you need to suddenly use a cane to get around? Activity-wise, are you not able to do the things that you want to do? Sometimes patients will come in. Often it's a reluctant, I will say, the pattern I see is a reluctant male patient who you can tell was sort of dragged there against his will. And I asked him how he's doing, and he's like, it hurts a bit. And then I asked the spouse, and they'll tell me he can't walk like he used to do. He used to love, going hiking and fishing and biking. He can't do those things anymore. We used to love going on walks in the evening. Now we have to turn back after a block or two. All of these things are things I want you to pay attention to, because all of these things really give us an idea of how much this is affecting you and what lengths we need to go to help you feel better. Next slide. So thinking about goal setting as well, it's important to keep things into perspective, right? Like I said before, unfortunately, with a lot of these arthritic conditions, we can't put the cartilage back. The cat is kind of out of the bag already. But we need to figure out a realistic goal for you. For some patients, they're okay with having arthritis. They're like, I'm okay. I understand it. I don't want surgery. I don't want anything like that. All I want to be able to do is get back to my biking or my swimming or being able to walk with my dog. And so it's really important to understand, what are your goals? What are you aiming for? So if you keep that track of your levels, like we said before, like keeping a diary of how you're doing, that helps with things. If you're learning to really how to describe what you're going through, and then explain how it impacts your life, a lot of these things might bring attention to you about what you really want. And I do this with my patients when they come in for me for surgery. I ask them, if I could get you to a particular goal after surgery, something you really want to get back to, what would that mean for you? For some patients, it's walking across the room without pain. For other patients, they want to get back to playing sports or something like that. But until you really take time to reflect on this, it's going to be difficult for you to understand where those goals are for you. So this is really important to take time to reflect on this and make sure that when you visit me and we discuss about things, we really have goal setting in place for understanding where we're going to get you.
Okay.
So another reflection slide. We'll talk about this and then I'll answer some questions. What are you currently tracking? Are there other areas of your life that you could be tracking? Are you thinking about all these activities or how it impacts your relationship with your family? And when you talk with your primary care doctor, if you haven't seen an arthritis doctor yet, are you mentioning these to your doctor? Are you bringing up the fact that you can't sleep properly, that you can't walk anymore? I would encourage you to think about all of these things and bring them up with your doctor. Even if you're not seeing an orthopedic surgeon or an arthritis doctor yet, bring these up with your primary care doctor, because this is something that is going to help you feel better and be able to live with your disease a little bit better. While you're thinking about that, let's see the new question that came in and tackle that a little bit. So the question is, I have arthritis mostly on the right side, my hip, knee, and shoulder. Lately, when I sit for a while, try to get up, I get cramps down the side of my thigh or the right side of my shin. I have to take some time until the pain settles and I can bear some weight. Why does this happen? Great question. I can't answer this for you 100% fully because it could be different for every person, and it would be easier if I saw and evaluated you in the office. But a lot of times why this happens is because the body, we think of the body as sort of isolated joints, right? This is your knee, it bends and it straightens and you walk on it. This is your hip. It rotates a little bit and it flexes and extends to help you get out the car. But the body isn't an isolated group of joints. It is a very complex network of things that work together. And if you talk to a really good physical therapist, they can take you deep down the rabbit hole of all this work together. In fact, there's some really amazing therapists who've shared about how the joints kind of alternate and work as a unit. Some joints are for more stability, some are more for mobility. There's things called your fascia, which is basically this little coating that covers your muscles, and the fascia tracks throughout your body. And there are some really interesting relationships when you look at the anatomy. For example, your left shoulder actually connects to your right hip. And so oftentimes people might have pain on one side and they don't even realize it's because of joint pain that's going on another side. But the bottom line is when things aren't working properly, it affects a whole bunch of different things. Your joints don't move properly. That has knock-on effects down the system. You don't move correctly. You don't walk correctly. That leads to overuse injuries in other joints, and it has a knock-on effect that affects a whole bunch of things. And that's part of what we do when patients come and see me as their doctor, is I try not to get too caught up on just the one place that the pain is presenting, because I try to look at the patient as a whole, because oftentimes you might be experiencing symptoms in one place, but the actual cause of it is downstream somewhere else. And so that's part of treating arthritis and joint pain and things like that, is really taking a holistic view of the whole patient. And oftentimes that's why I send patients to my physical therapy colleagues, because they are really the best at looking at this and taking care of the whole picture altogether and hopefully clearing things up for you. So let's talk again about building healthier habits, right? Because it's easy to talk about this stuff and everybody does that. You know, you watch a video, you watch a presentation like this and you're like, okay, I'm going to do it. But how do you do it, right? It's very important to do it in the right way, right? So it begins, you know, the famous saying, a journey of 1,000 miles begins with a single step. You have to pick something that is a step in the right direction, but that is also manageable, right? So it's not realistic to say to yourself, I'm going to lose 100 pounds in the next month. Not going to work. But it is realistic to say to yourself, every single day from now on, I am going to do at least 10 minutes of activity. And the way, you know, there's a very good book that I recommend called Atomic Habits by James Clear. I don't know how many of you in the audience have read it. I think it was a bestseller. I have listened to it myself recently, and it had very good tips on things like this. Two that have worked really well for me are actually basically alluded to on this slide. One thing is rule setting, right? One small step you can do every day. If you set rules, we're very good at following rules, but they have to be very, very specific. So, for example, for me, one rule that I use is I set a rule for myself every time I'm at the hospital operating. When I finish my operations for the day, I go to the hospital gym and I have a workout every time. That workout can be 5 minutes. There are times when I'm exhausted. I've been doing a whole day of surgery. All I do is go down there and I will literally maybe row 500 meters. I will do a couple push-ups and that's it. But it doesn't matter. The rule is never broken. I finish the surgery and I go do the workout. And some days you might have a terrible workout. Some days you wouldn't work out otherwise. And just because you're there, you're like, you know what? I'm here. I'm feeling good. Let's go. So rule setting is very important. So here's some examples that we give here. I'm focusing on adding protein to my breakfast. I would say I would be more specific than that. You have to be specific. So I would say over here, I'm going to drink a protein shake with breakfast every day. Or this next one is good. I'm going to take my vitamin with my coffee every morning. That is an excellent one right there. And the key thing here is thinking about what you can add to your routine, not subtracting. And this final tip over here, stack your habits, is an excellent one, and it goes well together with rule setting. So habit stacking is one where you say, every time I do this, I'm also going to do this. So take something that you do every day anyway. For example, brushing your teeth, right? Or something like that. And make a rule where you say, every time I brush my teeth, I'm going to do 5 push-ups. Pair them together. So you take one habit that's already being done every day and make a stimulus to do another habit that you want to develop. Start small and do it like that. So for me, that was my thing, right? I'm at the hospital operating not every day, but I'm operating anyway. Every time I operate, I also work out. So that's a very good way to do it. Next slide. Now let's talk about surgical options, right? This is where I come in. There's a whole bunch of different stuff we can do: arthroscopy, joint resurfacing, osteotomy, fusion. But really what my main expertise is joint replacement, although I do a lot of joint resurfacing as well. And so this is when you've got to the point in your life where you can't live with it anymore. You've exhausted all these other things. You've tried making the lifestyle changes. You've tried the medication. You've tried the injections, and it's still not working. It's still debilitating and affecting your quality of life. And that's where it comes in. We have incredible developments now. It says robotic technology here, although I would say robotic technology isn't necessarily the answer for everybody. I personally do not do robotic replacements, but it is one new thing that we have. But what is incredible now is the amazing bearing surfaces and different types of implants that we have. And it's really a changed game from, 20 years ago even. We used to tell patients, well, it's only going to last 15 years and then you're done. I don't see it that way anymore. When I do surgery on a patient, my view is this is it for the rest of your life, one and done, right? And whether that's a partial replacement, a total replacement, my goal is to get that joint moving well again and get you back on your feet and get you back to doing everything that you love. And even if you have really high demands, I have some patients who are young, active people who want to be able to play rugby and do jujitsu and stuff like that. And we have options for them too, because we have hip resurfacing, we have partial knee replacements, but joint replacements now are really a great option for people who've exhausted everything else and still can't, it's just too much of an impact on their life. And so we can do these. And now most of my patients go home the same day. We have you up and moving with physical therapy. We have you going up and down stairs hours after your surgery and being able to go home safely. So it's really revolutionized the care we can offer to patients. And that's my passion. That's what I do. And that's why I'm here today. Next slide. And then, in addition to all of these things, we have complementary management, right? So there's other things you can try. Physical therapy I mentioned before is one that I absolutely love, and I have some very good physical therapists that I refer patients to. You can have occupational therapists who can show you how to navigate life and get by even with the limitations you have. Meditation, the more we learn about meditation, the more we see the value that it brings in all aspects of health. There are some supplements, although I would caution you to not get too high on the hype with supplements, because some of them are, I think, overclaim and under-deliver how they can make you feel, but certainly no harm in trying some of them. And there's things like bracing and things like that, which I offer patients in the office, which again doesn't solve the problem, but can alleviate those symptoms, especially for patients who are kind of getting towards the end of their conservative management and are thinking about surgery. That's something that we offer too. So to summarize it, this is a multifactorial thing. We kind of it's a whole bunch of different things that go together in the picture, and it's a spectrum of where you are on the treatment plan. Some people come to me and they've got early disease, and I tell them, you and I are going to be friends for a long time because you're not even close to surgery. We're going to try all these other things. We're going to try the diet and the weight loss and the therapy and the injections and the bracing, and we're probably going to do that for years before you need surgery. There's other people who come to me and they're already bone on bone on day one, and they're like, I've tried the injections, I've tried the therapy, I'm done. I can't walk, I can't live my life. And in those cases, surgery is the right option. But our goal is to put all of this together, get that self-management, get the medical management, get the complementary therapies, and really guide you as your arthritis doctor to help you manage this and get back to doing the things that you want to do. And that's, like I said before, that's my passion, that's my goal. And hopefully, if I can help any of you to do that, I'd love to do that. All right. So I think we had one more question in the chat that I will address over here. And it says, I have a torn meniscus. How will that affect my likelihood of getting osteoarthritis? So you have to be cognizant with torn meniscus. And I don't know, Karen, how old you are, but if you already have arthritis, you're going to have a torn meniscus in your knee. You're going to have a torn meniscus. It kind of goes part and parcel with it. So, some people come in and they're like 80 years old and they're worried because they have an MRI that tells them they have a torn meniscus and they're all freaking out. I tell people it's okay. If you have arthritis, everybody over a certain age is going to have some degree of tearing in their meniscus. So if you already are a little bit older and you already have arthritis, it's probably a byproduct of your arthritis versus the other way. If you're younger and you have a torn meniscus, it increases the chance of you developing arthritis down the road, but not necessarily. A lot of meniscus tears may be very minor, can be treated with therapy and conservative management, and may go away on their own. It's just something that you follow with your doctor over time, and it could lead to it, but not necessarily. So can go either way with that. If anyone else has any other questions or anything like that, I'm happy to put them in the chat, and I'm happy to address them right now. So for those of you who hear this presentation and are interested in coming in and getting a little bit, talking to me about all of this, I'd be happy to see you in my office. We have at First Aid Orthopedics, we have a whole team. I'm one of our arthritis doctors. My main specialty is hips and knees, although I do shoulders as well. And I see fractures and chronic pain really in all kinds of, pretty much the whole body, tip to toe. But we have a whole team here. If it's not me, we have other specialists in all kinds of different body parts. And, that's kind of what we're here for, is to help have these discussions with you, guide you through this treatment plan. We have non-surgical specialists as well. And I saw a question come in just in the chat now. Can I have arthritis in the back? Absolutely, you can. In fact, very common. And a lot of times people come into me and they think that the pain is originating in their hip or their knee. And it turns out it's actually coming from the back instead. And so that's something plenty of times where I'll see them and I'll reassure them, your hips and your knees are okay. Really, it's the back we got to take care of. And, I'll refer them to some of my other partners who take care of backs as well. But here's our number. We have a line that you can book an appointment 24/7, 365. You could call midnight on New Year's Eve and someone will still be there to take your appointment. So you can call anytime and we'd be happy to see you. And let's see, we got a couple other questions coming in. All these services are referred from your primary physician. Depends on your insurance. Some insurances require you to get a referral. You just need to check with your insurance plan. If you don't need a referral, you don't need to be referred by your primary physician. You're more than welcome to call up and come in and see me, and we can discuss without going through your primary care first. It just depends on your insurance plan. But plenty of my patients just come and make an appointment because they're in pain and they want to see a specialist already, so not necessarily. And then what natural supplements do you recommend for osteoarthritis in the knee? Things like turmeric, I've heard good things about. I've had some patients who've had some really good response to that. There are those things like the visco supplementation, which I'm blanking on right now, but the glucosamine and things like that. I've had very mixed reports on that, and the literature is very inconclusive. Some patients really like it. I would say most patients don't feel any benefit from it. There's really no downside to it, though. So you can try it. The downside is just, maybe some money spending on it. But, natural supplements, I would say try turmeric or other anti-inflammatory type herbs and supplements like that and see if that helps you. That could be a good option for you.
Any more questions for our amazing speaker? Okay, awesome. Well, thank you so much. He's still going to hang on for the last 10 minutes. So if you guys think of any questions that you have for him or for Nancy, who I'm about to pass it over to for some quick information about what's going on in the Cooperative Extension Office, throw it in the chat and he most definitely will get to it for you. And here we are.
Hey everyone, just a couple programs that we offer here at Cooperative Extension around walking and chronic disease prevention. So a couple things that you might be interested in. Next slide. The first program that we offer is called Walk with Ease or Camina con Gusto. So we talked a lot about walking and how physical activity is good, especially if you do have arthritis. So Walk with Ease is a program that is sponsored by the Arthritis Foundation. It is an evidence-based program. We do offer it statewide here in Delaware. We offer it a couple different ways. It is held live via Zoom, or there is an email version that we offer, and that is available in English or Spanish. Part of Walk with Ease, there are educational sessions that are offered, and there are walking sessions that are encouraged at least 3 times a week. Those can be done self-guided on your own, or we have created community-based walking clubs, which I'll talk more about on the next slide. Walk with Ease also includes motivational strategies. So Dr. Kergel did talk about goal setting and the ability to overcome barriers. And there's also fitness testing that is included in Walk with Ease or Camina con Gusto that is 2 times during the program. Next slide. So Walk and Roll are community-based physical activity clubs that are offered during the same times as Walk with Ease. And the reason that they are standalone is because we know that some people are already familiar with how to set up a basic fitness program, and they just want to join a social accountability group. And I know we do have some people on the call today who have taken Walk with Ease and have enjoyed it very much. These are also held statewide, and the clubs meet for about an hour. All of our leaders are either Master Wellness volunteers, which is our volunteer group through Cooperative Extension, or led by a Cooperative Extension staff member. Everyone is CPR certified. They lead a warm-up and a cool-down and stretches, and then they are there to motivate and encourage participants. And we do collect some data around our walk club participants. It includes the number of minutes walked. We also encourage everyone to walk at a rate of perceived exertion, to make sure that everybody is, pushing themselves a little bit to make sure that, they are getting something out of their walk, but that they're walking at a pace that is safe for them. So here's a little bit about where our clubs are currently held throughout the state. We do have one in Sussex County currently in Seaford, and we will be adding one at Sandhill Fields. That's actually a typo. Coming in the spring, and then we have 2 currently in Kent County and 3 in Newcastle County. And then we also keep up with all of our current and past walking program participants through a newsletter that we call Move More. Even though all of our adult physical activity programs do focus on walking, we know that the best physical activity is the one that you're actually going to do and stick with. So we do, talk about other forms of physical activity and things that people enjoy. We do encourage everyone that if you can be on your feet for at least 10 minutes without any form of pain, that you can participate in our physical activity programs. And of course, we encourage, everyone before they start any physical activity program with us, that they do reach out to their medical team and make sure that it's okay that they participate. We do send out a newsletter a couple times a year, just to let folks know about things that we have going on, such as the lunch and learns like this, and when our programs are coming up, and any other programs around nutrition, physical activity, mindfulness. We have a lot of different programs and the health and well-being team offers throughout the year. So if you are interested in staying in touch and learning more about what we do, please sign up for our newsletter. We will be sending out the registration for our spring programs just after the first of the year. So that link will be ready sometime in January. We would love to have you as part of our programs. Just reach out. We also have our Master Wellness Volunteer Training coming up in January. So if you are interested in being involved with that program and leading a walk club somewhere in the state, we would love to have you involved in that as well. So thank you so much for coming today.
And finally, again, I am Asia. I'm the Director of Patient Education here at the Arthritis Foundation. So if you got any emails, they were likely from me. Couple of last things. Because you joined this webinar, and we are really, really happy about that, You will be getting an email later today as a thank you with a DoorDash gift card because it's a lunch and learn and you gotta eat lunch, right? So that will come to your email and it will probably have my name on it. You also will get the recording to this because we want you to watch it, refer to it when you have questions, and also share it to your network. But some cool things that we have in terms of the Arthritis Foundation. So we have podcasts, we have webinars. We actually have a webinar coming up on December 6th, Better Healthcare Through Communication. You can sign up for that at our arthritis website. To build community, we have connect groups. So think small groups where you get to collaborate, share information, just talk about what you're going through and any new updates in just the field of that particular medicine. We have one for military vets, OA, like this session, newly diagnosed, African American, family planning, gout. So there's quite a few of them. I'm sorry I'm missing the exact number that we have, but Heidi is the director for that and she is amazing. So please let us know if you're interested in that. You can also find that on the website. And finally, we have more of these Living Well series. So actually on December, what day, the 8th, we have one of these same virtual webinars, but for virtual life hacks to get through the holidays. So think helpful tips and ideas to live more comfortably and fulfilling while having arthritis. Like think in those really cold mornings where your joints are kind of achy and it's hard to get out of bed. We have a solution for that. We have, hey, maybe you should use a heating pad or do some gentle stretches in your bed before you get out of there. So that is what that's going to be on December 8th. Similar format. We have a physical therapist that's actually going to be hosting that one. And so let us know if you're interested. I will make sure that my particular email is in the chat, but I'm going to step back, give the last 2 minutes to see if you guys have anything you want to end with, and we'll be good to go.